I want to congratulate you all. This is the 7th of the 7 planned forums, but you're going to get some new information that the other folks didn't get because we've had an evolving situation, and I think it's a better scenario. But so some of the things that you're going to see in the PowerPoint that we've developed is a little bit different than what I'm going to say. And so what I'm going to say kind of overrides a little bit what's in the PowerPoint. But we're going to go ahead and get started. Again, the purpose of today is really to do 3 things. One is to explain the executive order, the governor's executive order that was issued on August 26th, and what that means to us. I'm going to walk through some very specific elements of the executive order, and I'll let you ask questions as they come up in your mind. Afterwards, we're going to have another section of this session aimed at answering questions that you might have. And then finally, what I'd like to do, because we're putting this response together very quickly, is just gather your input on some things that we might do to help make this a little more or a little less stressful on you and a little easier for you to do. Today is not about debating whether or not vaccines or COVID or any of that stuff exists, or the philosophy behind it. That's for another day, for another discussion. Today is just about explaining what's going on and trying to help you get prepared for next week. So, any questions on that? The executive order that was issued by the governor last week was about 8 pages long. And if you've had any kind of exposure to any kind of legal documents, half of that is providing rationale as to why the order was being issued in the first place. And so there's about half the document that talks about the reasons why the governor issued the order. After that, the other half is kind of broken up into 3 areas. The first area was providing guidance and expectations for healthcare facilities and healthcare workers and state facilities. A second section was identified at what the expectations were for the K-12 environment and students and employees there. And then the final section was had to do with higher education and what the expectation was for students and employees in the higher education area. I'm not going to go through the entire executive order. If you really want to look at the whole thing, you can go to Google, you can talk about Governor of Illinois' executive order on August 26th, and it'll pop up and you can go through the entire thing yourself. What I'm going to talk about today is just the part that really applies to us so that you have a pretty good understanding of what these expectations are. As with any legal document, oftentimes there's a section on definitions. Because they use terms over and over again, they want to make sure that everyone understands what they mean by those terms. And this document is no different. One of the terms or phrases that they use throughout the order is institution of higher education. And so the definition for institution of higher education is up here on the screen, but really all it amounts to is the important takeaway from this is it applies to community colleges, okay? The other thing that they talk about is employee definition. The employee definition that they're using for the purposes of this executive order is a little bit different than what you might normally expect that would be an employee would be. So I'm going to read it to you right out of the executive order. Higher education personnel means any person who is employed by, volunteers for, or is contracted to provide services for the institution of higher education, or is employed by any entity contracted to provide services for an institution of higher education, and is in close contact, which means fewer than 6 feet, with other persons on campus or in a campus affiliated building or location for more than 15 minutes, at least once a week on a regular basis. So what this means basically is they've expanded kind of the definition of what higher education personnel looks like. It's not only employees of the institution, but it's volunteers. So if you're in athletic programs, you know, we have scorekeepers, we have groundskeepers, we have people that help keep the statistics. Those are generally volunteers. This executive order, this mandate applies to those individuals. We have people who are volunteer to help in adult education and community education. All over the college, we have volunteers. And volunteer person, this applies to that individual. It talks about contracted services. Our security team here is a contracted service from St. Moritz. Those individuals, this mandate applies to them. Our janitorial and maintenance team is from Crowdis. They are on campus and this executive order applies to them. So please understand this executive order pretty much applies to just about anybody that's on campus for any period of time that's really more than 15 minutes, as you see here. The term higher education personnel does not include any person who is present on campus or affiliated with any off-campus location for only a short period of time, and whose moments of close proximity to others on site are fleeting. So for those kinds of individuals, what they're really talking about there is we have delivery services all day long. We get FedEx, we get UPS and so on. Those individuals bring in materials, they're on campus and they're off, they're not consistent. Generally, they're not really close to people for more than 15 minutes. This executive order does not apply to those individuals. But that's pretty much the exclusions as it relates to employees. Are there any questions about that? And we are having remote participation in this event. And so if you do have a question, we'll bring the mic to you so that the remote people can hear the question being asked. So the next part of the definitions is a student definition. So what is constituted by a student is related to the executive order. The language that they use in the order is higher education student. And that means any individual enrolled in a credit-bearing or non-credit-bearing course at an institution of higher education, either on campus or at an affiliated off-campus location. So basically, it doesn't matter if you're taking a community education course, an adult education course, any kind of credit course or non-credit course. If you're on campus, you're subject to the impact of this executive order. So this means not only here at our main campus, but also at all of our extension centers as well. So it's at Metropolis, it's at Caro, it's in Anna, and it's in Vienna. Higher education student does not include individuals who complete their coursework exclusively remotely. So this does provide an option for individuals who are not going to be on campus, who are taking their classes all remote, online, however we do that. They're not subject to the mandate. However, and people have asked this in other forums, if you're that on campus, if you're that remote learning student and you have to come to campus to visit the library, or you're coming to campus for tutoring or for extensive registration activities or counseling activities, then you do apply. The executive order does apply to you. So any questions about the student definition that's used here? Another definition that's used is fully vaccinated individual. This is a very consistent definition that we've been using since the vaccine has been around. Fully vaccinated against COVID-19 is the language that's in the executive order. So what that means is 2 weeks after receiving the second dose in a 2-dose series of COVID-19 vaccination authorized for emergency use, licensed or otherwise approved by the FDA. So in other words, they're talking about the Pfizer, what we commonly call the Pfizer and the Moderna vaccine. Or 2 weeks after receiving a single dose of the Johnson & Johnson COVID-19 vaccine authorized for emergency use, licensed or otherwise approved by the FDA. So what this means is fully vaccinated is 10 days after you receive the last vaccine that you need. So, and it's been that way consistently. So for example, if you're in the 2-dose protocol, so if you're taking the Pfizer or the Moderna, then you get your first shot. I think the Pfizer is 3 weeks later. You can get the second shot. The Moderna is 4 weeks later. The time that you're going between shots, you're not fully vaccinated. Also, Once you receive that second shot of the Pfizer and the Moderna, you have 10 days before you are fully vaccinated. So even though you received both shots, you're still not fully vaccinated. And that's why they use the word fully vaccinated, or the term fully. The Johnson & Johnson, again, you get that shot, 10 days later, you're considered fully vaccinated, but the same situation applies. Once you receive the Johnson & Johnson, you're not fully vaccinated until that 10-day period has elapsed. Any questions about what fully vaccinated means? Alrighty. So this is what the executive order says. All higher education personnel and all higher education students must have, at a minimum, the first dose of the 2-dose COVID-19 vaccine series or a single dose of the COVID-19 vaccine within 10 days after issuance of this executive order, and be fully vaccinated against the COVID-19 within 30 days following the administration of the first dose in a 2-dose vaccination series. So what this means is, this is the vaccine mandate part of the executive order. This is saying vaccines are required for all higher education personnel and higher education students. It goes on to say, any higher education personnel or higher education student who has not established that they are fully vaccinated against COVID-19 must be tested. So this now provides a contingency for you that say if you, for whatever reason, you're not choosing to be vaccinated at this point in time, you can now test. And so this is the testing part of this mandate. So this mandate is often being referred to now as the vaccine testing mandate, whereas originally, it was just supposed to be referred to as a vaccine mandate. The executive order goes on to say, to establish that they are fully vaccinated against COVID-19, higher education personnel and higher education students must provide proof of full vaccination against COVID-19 to the institution of higher education. So what that means is you have to provide proof that you've been vaccinated. How do you do that? Proof of COVID-19 vaccination is a CDC COVID-19 vaccination record or card as one method. A second method is you can provide documentation of vaccination from a healthcare provider or an electronic health record, or you can present us with state immunization records. So consequences for non-compliance. This is in the executive order as well. An institution of higher education shall exclude, which means we can't let you enter, higher education personnel and students who are not fully vaccinated against COVID-19 from the premises, unless they comply with the testing requirements. And so what this is saying is by law, now this is not coming from Shawnee Community College. This is not coming from the Board of Trustees of Shawnee Community College. This is not coming from Tim Taylor, the president of Shawnee Community College, or any employee of Shawnee Community College. This is coming from the state of Illinois, from the governor, through an executive order, which has the full force of law. We have to exclude you from campus if you're not vaccinated or you're not participating in the testing requirements that are outlined in the executive order. Does everybody understand that it's not us requiring this, that it's the state? Okay, so let's talk about the testing requirements that's outlined in the executive order. It says, beginning 10 days after the issuance of this executive order, this executive order was issued on August 26th. 10 days later is September 5th. To enter or work at an institution of higher education personnel and higher education students who have not been fully vaccinated must undergo testing for COVID-19, as described on the subsequent slides. So if you choose not to get vaccinated, until you make the choice to get vaccinated, you can participate via testing. And this is what testing requirements are in the executive order. Higher education personnel and higher education students who are not fully vaccinated against COVID-19 must be tested for COVID-19 weekly. So it's weekly testing. And this is at a minimum. Testing must be done using a test that either has emergency use authorization by the FDA or by operating per the laboratory developed test requirements for the U.S. Centers of Medicare and Medical Services. Such testing for higher education personnel or higher education students who are not fully vaccinated against COVID-19 must be conducted on site. And so that means here at the college. Or the Institute of Higher Education must obtain proof or confirmation from a higher education personnel or higher education student who is not fully vaccinated against COVID-19 of a negative test result obtained elsewhere. So what this means is you have to either test here or you have to test at one of the many available testing sites throughout our community. We plan to put together and make it easy for you an on-site testing facility. It's just going to take us a few weeks probably to get that up and going. Until then, testing out in the community is what's required by the executive order. And we would need to see the results of that test. And then it goes on to say IDPH recommends higher education personnel and higher education students be tested using PCR tests if available. So there are really 3 types of tests that can be done. The first test is a PCR test, and those are the standard tests that we're all used to hearing about. The test that we're going to bring on campus is a PCR test, but it's not the swab kind of test. And I'll talk more about that in a few minutes. But there's also antigen test. So if you've heard of something like Binax now or rapid testing, that's typically the antigen testing. And then there's a third type of testing that's not allowed called antibody testing. The antibody testing does not meet the requirement, so, but either of the other 2 do. Questions about the testing requirement? Okay, now the executive order does identify exemptions, potential exemptions from this mandate. And these are the exemptions. Individuals are exempt from the requirement to be fully vaccinated against COVID if vaccination is medically contraindicated, including any individual who is entitled to accommodation under American Disabilities Act or any other law applicable to a disability-related reasonable accommodation. So that's one exemption. The second is vaccination. If vaccination would require the individual to violate or forego a sincerely held religious belief, practice, or observance. Here's an important element though. Individuals who demonstrate that they are exempt from vaccination requirement shall undergo, at a minimum, weekly testing. So what this is saying is, if you have a medical condition that prevents you from receiving the vaccine, it's okay. You're not subject to the vaccine part mandate of this. If you have a sincerely held religious belief that prevents you from participating in the vaccination program, that's okay, but you still have to test. All right, and that's critical to understand. You have to test if you don't get vaccines. That's the testing part of the mandate. Now, there are individuals who have asked questions in the past that says, what if I have a medical condition that prevents me to test? Or what if I have a sincerely held medical religious belief that prevents me to test? This conversation has been had with a number of attorneys throughout the state over the last week. The majority of attorneys, including the ones that represent the governor's office, including the ones that represent the Illinois Community College Board, including the ones that represent the Illinois Community Council of Presidents, all agree that there's no medical requirement that would prevent somebody from testing, especially the type of testing that we're going to be doing here on our campus. They also agree that there is no medical or no sincerely held religious belief that would prevent someone from testing, especially the saliva-based testing that we're doing. Now, you're going to hear out in our community different viewpoints on that. In fact, I know some of the K-12s are actually allowing this exemption for testing. That's their lawyers and their team recommending direction for them. Our lawyers and our legal team is recommending that we not allow a medical exemption or a sincerely held religious belief exemption for testing. So until that changes, and it will probably change pretty soon, I imagine it'll be litigated really quick. Till that changes, that's Shawnee's stance. You either have to get the vaccine or you have to test. It's really that simple. Any questions on that? Now, somebody's raised there's a law on Illinois, there's a statute in Illinois' books that's, I forget exactly what the number is, but it's called the Illinois Health Care Right to Conscious Act or something like that. Our lawyers specifically reviewed that particular act and believes that it does not apply in this situation. So, I mean, you can use that as an argument for us, and we will be very sympathetic and listen to your argument, but at the end of the day, we will be moving forward with mandatory vaccinations or testing. Any questions? All right, so probably this is the extent of the executive order that applies to us. So I really want to talk a little bit about the college's response. We're looking at the response being in two phases. The first, because this was issued last week, as you might imagine, this is a monumental task for the college to get organized and bring things together. We really are working on and inventing this right now as we go. As we implement this, we're going to make some mistakes. We're going to probably get some things wrong. We're probably going to irritate a bunch of people, but we're going to try to do it as conveniently and easily as possible. For the moment, and some of these things have changed since noon today, but we are going to establish entry points. These two entry points are only going to be for the next few weeks, for the next couple weeks. The purpose of the entry points right now is to allow you to come in. We are going to give you a kind of a vaccination testing pass card. It's going to be color coded, and basically it's going to allow you to come in the facility just showing the card from after that point forward to show that you've been either vaccinated or you're participating in the testing process. And so if you keep that with you for the next 2 or 3 weeks, once you get it, you'll be able to come in, no real problems or worries. Now that card will have to be renewed weekly because this is a weekly testing mandate. So next week when we come in, you'll give you a card. The week after, you'll need to bring that card in and get it updated. But that should only take really briefly a minute or so. We're going to continue to do the temperature and symptom screening checks as we have done since COVID has been around. Next week, students and employees will be asked to provide their vaccination information. And we will likely do that for a couple of weeks until we make sure that we have everybody's vaccine cards in our database. And then next week, in subsequent weeks, likely we'll make sure that unvaccinated employees and students will be advised of the weekly testing requirement. Plus, we will provide you with information on where you can get tested and the types of tests that are acceptable. Where you can get tested and what the types of information or the types of tests that are acceptable are already links on our COVID-19 webpage, but we will also give you hard copies of that. We will allow everyone through the door to their classes, to their workplace next week. There's going to be nobody sent home. We're not keeping you off campus. We're not doing anything. We're just trying to help support you. We're going to help you make sure you understand the requirements. We're going to make sure that if you got questions, they can be answered at these support centers at these two entry points. So as you get test results, if you're an employee, those will be sent to Emily Forthman in our HR department, and students will send their test results to Dr. Kristen Shelby, and I'll have their contact information up on the screen here at the end of this presentation. Any questions about phase one? Okay, phase two. Then this one's changed pretty significantly since noon. But again, we will probably, by the time phase two, what triggers the change from phase one to phase two is when we actually have live testing on campus. So right now, we're anticipating that to be 2 to 3 weeks. That actually may be longer. Just kind of depends because everybody in the state has this mandate, and the company that we were tending to use for this shield is the one that's being selected for basically all the universities, all the community colleges, many of the K-12s throughout the state. And so they are getting slammed. They're having supply chain issues. But we think because we were in the pipeline before most of these other schools, because we were intending to go this direction anyway for our athletes, that we might get it here in 2 or 3 weeks. But it could be 3, it could be 5, it could be 6, it could be 10. We don't know yet. So as information changes, we'll let you know. But the transition to phase two will be when we're able to have live testing on campus. Now that live testing will not only be here at the central campus, but it'll be testing at all of our extension centers as well. So we'll have testing options available if you want to go to Carroll, or if you want to go to Metropolis, or if you want to go to Anna. Vienna already has their own testing protocols in place. So that's when phase two kicks in. At that point, we won't need the ID check-in cards because we'll have an electronic system that we can track and look at. And we're going to hire an individual to coordinate this for us. And we're in process of doing that today. We're hopeful that that person will be on within the next week, but hopefully within the next 2 for sure. But then on-campus testing from an organization called SHIELD will then be on helping us provide testing for our students. So I just want to talk a little bit about the SHIELD testing and what it actually is. If you've ever had a COVID test, you probably had to have that swab test where they stick it up your nose and it kind of hurts and makes your eyes water and that kind of stuff. This is not that kind of a test. It's less invasive. So essentially what will happen is when we come in, we will have a place for you to come up and check in with the testing site. The testing site will scan, you'll have your own ID that you can probably put on your phone that you can just kind of pop up, you know, kind of if you were going to a concert or something. It'll read it, and then the individual will hand you a sack, and it looks just like a lunch sack. And so if you open up the sack, inside it is a test tube and a funnel already put together. And so then we'll have a space for you to go over to the side, and what they call drool, it's really kind of spitting into a test tube. When you're done, you take the funnel off, you throw it away, you put the cap on the test tube, and then you put it in a container that we're going to use to ship to Springfield for testing. Now, and that's it. It takes less than 5 minutes, probably less than 3 minutes to actually do, and then you're done for that week. So that's what we're planning to implement. To make that happen, as we get closer to the implementation of SHIELD, we're going to make sure that you have the opportunity to sign. You're going to have to sign up for an account on SHIELD because they're going to issue your unique ID. Your unique ID will then be connected to the agency code for Shawnee Community College. And so what will happen is when that test gets sent up to Springfield, within 12 to 14 hours, you'll know or 12 to 24 hours, you'll know the results. And the minute they tested your tube and they know the results and type it in, that message is pushed to you, it's pushed to the college, and it's pushed to IDPH at the same time. And so then you'll no longer need to provide us with testing results because we'll automatically have them. And so this is about as simple, I think, that we can make the testing requirement. The testing is going to be on our campus. It's going to be free to all of our students and employees. It's just a minor inconvenience, but it's something that we need to do to comply with the executive order. And again, all unvaccinated employees and students will test weekly. If you're vaccinated, you don't have to worry about testing. We'll know that, and things will be much easier from that point forward. As we have decided today, we're not going to have the checkpoints or the support centers once on-campus testing gets here. We will have an individual who can monitor our database, and they will reach out to individuals to remind them of their testing dates and to see if they're struggling with or obtaining any, solving any of their issues as it relates to the testing. So we won't need those entry cards anymore. They'll just come in and go to class just like you're doing right now. Now, if somebody reaches out to you, they're probably going to want to schedule a testing time. We'll test that. We'll bring those people in. We're planning on having testing available 5 days a week, all the hours of operation. So it should be as convenient for you as possible. So with that, that's kind of explain what phase 2 looks like. Now I want to, really kind of emphasize this is a work in progress. And these things will change over time as we get clearer information, but this is our plan moving forward. So at this point, I'm more than happy to spend as much time as necessary to answer any questions that you might have.
Cool. So if we do decide to get the vaccine, well, like the Pfizer is 2 shots. If we get our first shot between I know you have to wait a certain amount to get the second shot or whatever. So like we say we get our first shot, between that time and the time we get our second shot, will we still have to be tested until we get our second shot?
Excellent question. And the answer to that, unfortunately, is yes. In order to comply with the executive order, and we asked the lawyers that, and I was actually on the line with the governor's deputy secretary the other day, Torres, and that's exactly the expectation. Until you're fully vaccinated, testing is required. And so you're not fully vaccinated until 10 days after. So even after you've got it, for those 10 days, those 2 weeks, you're going to have to test. But after that, you're golden, at least for now. Mm-hmm.
So if somebody decides that they do not want to get vaccinated at all, will you only require like a certain amount of testing and then they won't be able to come to campus anymore? Or
no?
Okay.
As long as you continue to test, you can come as long as you like. That complies with the mandate. And we're not going to forbid you from coming to campus. And in fact, this afternoon, we're talking about what it looks like if somebody misses a test. We're not going to, keep you from coming to campus because you miss a test. We're going to probably help coach you through that and get you brought up to speed. So we're not going to, don't fear that if you miss a test or you get sick for some reason, maybe it's not even COVID related and you can't test. We'll figure out a way to make sure that you're not barred from campus or anything like that. We got a question here and then we'll get to
so if you test negative, so when you go into that class, do the whole class got to be quarantined?
If you test negative?
Yeah.
No, if you test negative, that means you don't have COVID, so there's no result. If you test positive, then if you test positive, then of course you have to quarantine, which is no different than it is now. And then it really would depend, then we would go into our normal contact tracing procedure. So we would ask you questions about who were you around for more than 15 minutes, were you masked, and we would then, we have to do our normal contact tracing protocols. Good question.
So with that, sir, with a follow-up on her question, if you did test positive, then are you going to allow them to do it remotely learning while they're out?
It really kind of
with
depends
quarantine?
on what kind of class it is. If our faculty have the ability to conduct the classes remotely, or they are conducting the classes concurrently remotely, because some of them are, then absolutely we'll be able to do that. But some of the classes aren't set up to do that. And so, especially the ones that have, heavy duty labs. And so then we will make we're talking about with the faculty right now, how to make accommodations for that scenario, but we're really going to try to make sure that students have opportunities to make up that time.
Okay. And then my other question is, like with my daughter, she has to carry an EpiPen because she's allergic to everything, like every bush, every tree, food, that kind of thing. And that's why I still have concerns about the vaccine. I work in the medical field, and of course you're told several different things. And so, yeah, me and her doctor have talked about it. And like I told her, I said, Alexis, apparently you're going to have to either test or get the shot. And then with all the different things you hear on the news about possibly young women becoming sterile, you know, I mean.
Well,
it's-
certainly. You know, I fully support individuals' right to choose as it relates to the vaccine. And I think it's appropriate, and there are very sincere religiously held beliefs. Sounds like she has a medical condition that would not prevent her. So she would want to go down you will want to go down the path of testing. And the testing is very, you know, non-invasive. I mean, if you spit the water out of your mouth for toothpaste, you know, when you brush your teeth, I mean, that's about what this is like. So I don't think that you'll have any problems complying with the mandate. And we're not going to pressure you to get the vaccine.
Okay, because like I told her, I said, I just want to be sure, you know.
Right, the state, and that's why I want to make sure that everybody understood, the state's saying this is a mandate, vaccine mandate. The college is not. We're implementing what we need to do to comply with the law. We're not going to tell you to get a vaccine.
Okay, because she just enrolled in the nursing program. Is that a mandatory thing to become in the nursing program?
Yes, now,
But if she's allergic?
it's not mandatory right now for our nursing program. It's mandatory to be in the clinical facilities. And so like SIH, Baptist Health, they're requiring all employees to have vaccines, and they are not allowing exemptions. But that's not our choice. That is their choice, and we have to comply with their requirements. And so that's all the colleges around here that use those as clinical facilities, but we're not requiring it at this point.
Yeah, thank you.
But you won't be able to complete the program without having the clinical part of the program, at least right now, unless something changes over the next year or 9 months or whatever.
There's a question in chat. You want me to just read it?
Yeah, just read it off, please.
I'm sorry if I missed this, but has there been any guidance as far as boosters?
As far as boosters, there is not right now. I would suspect that might be a change that is made once those become widely available. I think they first hit towards the end of September, early part of October. That's when is it 8 months or something like that you have to wait before the booster? So the first vaccines came out about 7.5 months ago. So 8-month booster be up. It's not part of the mandate now. So we are not doing anything that's not part of the mandate. But if it does change, and these executive orders, I don't know if you know how they work, but they're issued for 30 days at a time. And so he likely will execute another executive order at the end of September, around September 25th. It may be included in there. And if it is, then we'll have to respond. Otherwise, we're going to head down the same path that we're heading right now. Other questions? All right, so while you're thinking about questions, let me ask you to also think about what are some things that you feel like, because we're making this up kind of as we go along, what are some things that we could do to make it easier for you? Be less intrusive on your life. Any thoughts? Well, I tell you what, here's where I will stay around and answer questions as long as you like. There's the contact information if you're a student. Dr. Kristen Shelby will be your contact. There's her contact information. If you're an employee, Emily will be your contact. There's her contact information. If you've got ideas on what we can do to make this a little bit better for you, let those folks know. They're the points of, they have teams that are working with the students in the student area or the employees in the employee area. And then we're going to bring that information to their teams as we develop these protocols. But again, thank you for coming out and listening. We really appreciate it. We're trying to do our best, and we'll go from there. But again, I'll stick around and answer any questions that you have.